Like to was in the military, did my training in military, and had 10 good years. I still look upon it with a lot of fun. It was a lot of good years. But today I currently work at the University, or Oregon Health Sciences University, the University of Oregon's medical school, where I'm a surgeon, trauma surgeon, a critical care doc, and I've been doing nutrition since I got my PhD in nutrition about 25 years ago, 35 years ago now. And, I've really watched things go, and, in the military we had a lot of projects going. We actually had a big NIH conference a few years ago called Nutritional Support for the Warfighter, DoD funded, but through the National Institute of Health. We learned a lot. We learned a lot exactly what the general is telling us, is that, when a troop goes out to do battle every day, in a deployed setting, and has to come back in, he doesn't want to go eat MREs. I mean, I ate MREs for 9 months when I was deployed to Iraq, but you don't want to eat MREs. You want to eat whatever makes you feel good. Whether it's Haagen-Dazs ice cream, I actually look forward to Haagen-Dazs when I come back from doing something all day long. Operate all day, come back, go out and get some ice cream, And so I think that's what we got to teach the military and teach the people, as I teach my young residents and young medical students. We've got to teach them to somehow make the people understand what they got to do, and because we're setting off a chronic inflammatory state in Americans today. And it's across the board, everybody. And so really, can diet change this is the question we have to ask. We know, and sort of relating to this whole concept is, we're in a chaos right now, what we're doing, We're not winning our war against inflammatory conditions. As Napoleon said here, the war is a battlefield's chaos, and we're in a battlefield. We're fighting what's going on in our kids, in the health, trying to get them to eat right, because look at our conditions in our health. We've got diabetes, obesity, cancer, targeting this inflammatory. Right now, inflammatory diseases account for 86% of the healthcare dollar. You start looking at that and you say, gee, we have billions and billions of dollars. So I think, we've known for a long time that inflammation goes two ways. I mean, this is from a famous textbook by John Hunter in 1794, showing that inflammation takes many forms. The same disease process, different disease process has the same inflammatory concept. But look what's happened. We've gone from infectious disease in this century, in my lifetime, you can see 1950s, I was born in 52, look at these, all coming down. So we think, great, science is working. But look what's happened. Rheumatoid arthritis, obesity, Crohn's, multiple sclerosis, neurodegenerative disease, Alzheimer's, Parkinson's, type 1 diabetes, asthma, all going to almost exponential levels. Here lies the problem. The question is, can eating the right diet make a change? Well, what are we doing besides everything else? We've changed our microbiome. Everything we eat alters the bacteria in your intestine. That's my area of research now. We're spending a lot of time on that, but we know, lifestyle changes. Newborns are getting by C-section, immunization, domestic pets. Great studies showing you buy a dog, within 48 hours, the youngest child in your house gets the dog's microbiome very fast. And that's all been shown very nice. All these things. But really, proteins, fats, the additive, the emulsifiers, there's tremendous data now. This ranch dressing we have here is full of emulsifiers. I have it somewhere. I go out because my wife took it all out of our kitchen when I showed her the science articles on emulsifiers. Sweeteners. We know now that artificial sweeteners change your metabolism, increases your risk of metabolic syndrome. Diet Coke, which I used to be addicted to, still has one, sneak one once in a while. Antioxidant preservative, refining grain. Here's what the problem was. The refining of grain. About 1920s, we learned how to take the germinal center out of grain, okay? And we did that for a reason. It made sense. Because now you can store your grain in a silo for 3 to 5 years. You're not at the mercy of selling it that year because it'll go rancid in the silo. So you were stuck to harvest your grain and sell it. But now when you degerminate it and you leave just the carbohydrate there, you no longer have to worry about really going rancid and destroying the whole crop. So you could sell it at a better price later in the year, the following year, the following year. So that made a difference. But what happened? We lost all of the good stuff in the grain. Basically, what are we feeding our chickens and our pigs and our cows? Pure carbohydrate. Well, they can't make omega-3 fats. So what are they making? Sugars, carbohydrates, and fat, which are all made from a pro-inflammatory 18-carbon omega-6 fat, because your body can make it from sugar. We can't make the good fats that come in the germinal center. So we destroyed that. We lost that. So there lies the problem. So if we look at all this stuff here, we say these are all things in your diet we can make as anti-inflammatory. The big ones, of course, are some of the vitamins, some of the trace minerals. Probiotics now is a big issue. Omega-3 fats are probably the biggest one with the most data and the most science. So let's do a case. Now I'm a trauma surgeon. Okay, so this is a 63-year-old male, relatively healthy, mild hypertension, untreated. Okay, he gets a little dizzy in the morning and just gets up and figures he'll go downstairs not to bother his wife. And as he's going down the stairs, he falls down the flight of stairs, gets a hypertensive intracranial bleed, and not sure if it's from the fall or from the hypertension. But he goes to the trauma center and they admit him. So now his right-sided hemiplegia, so his whole right side is out. Okay? And he's got significant inflammation. So the key here is, what do we got to do? This is like the TBIs we see in our young troops coming back. We've got a big TBI project going on now. We got, in our place, about $3 million DOD money. $1 million of that's studying TBIs. $2 million of that's studying coagulation in my department. Okay, now if you look at that, what do we want to do here? We want to stop the inflammation, because it's the inflammation, it's the surrounding area where the cells are dead, which can make this stroke become worse or better, right? It's called the penumbra. You've got some cells which are gone. They've been injured enough. It's the cells surrounding that. If you get more inflammation, you'll damage more cells. If you get less inflammation, you can save those cells and save that brain, because the brain doesn't regenerate. Not like your liver or some of the muscle. So that's what we're trying to save. Save that. So we thought, okay, well, we know we got inflammation, but every career, lots of careers in medicine have been, how do we slow down inflammation? How do we stop osteoarthritis? How do we decrease diabetes through decreasing inflammation? We forgot to talk about resolution of inflammation, okay? So if we look at resolution, we've got these things called pro-resolving mediators, which have been discovered by Charlie Sirhan a few years ago. Those and the endocannabinoids are very big in the idea that we can slow down, we can resolve it faster, not only inhibit it, but also resolve it faster. And that's a big key. So if we look at this list here of pro-inflammatory versus less inflammatory fats, you can see the fish oil sit over here all the way by itself. Olive oil is considered the neutral fat. The Mediterranean diet uses mainly olive oil and lots of fish. Okay, we now know in 4 studies, well over 3 million people prospectively trialed, the Mediterranean diet works. Decreases heart disease, cancer, and other inflammatory diseases, asthma, type 1 diabetes, type 2 diabetes, So, but if we're over here, you can see we got a problem. And where are we? Intravenously, we only had this until just recently. Now we can get some fish oil. So we know fish oils have got all kinds of stuff, and I won't bore you today with biochemistry. You know, whether it's clinical data or biochemical data, you can see lots of good stuff. If we look at diseases, we've got data now, 5,000 prospective randomized clinical trials showing benefits of fish oils in all these. Cancer, asthma, all these. Psychiatry issues, depression, suicide is even better. Prospective randomized trials in Japan show us fish oils decrease suicide risk. Depression. So major fish issues. Well, we used to think, how's this work? We used to think EPA and DHA goes down through here and stops inflammation through their carcinoids. Remember, because these are pro-inflammatory carcinoids. Now we know that's the tip of the iceberg. We've got all kinds of binding. We show better muscle function. We showed slowing of all kinds of respiratory parameters better. But here's the best study here. This study is a clinical study, but done in healthy college students, similar to our active duty guys, okay? So what they did here was done by, Matt Berger and Renee Trollier's lab in Lausanne, Switzerland. So what they did here is they infused fish oils or olive oils for 1 hour. Olive oil being a neutral fat. Okay, after 1 hour, they gave them purified E. coli endotoxin, which makes you very sick. Okay, that's what we see when people got sepsis. This is purified though, so it's not so bad. And they looked at the metabolic response comparing if you have fish oils on board versus just having olive oil, which is a neutral fat, not even a pro-inflammatory fat like we're eating. Okay, and what happened? Every metabolic parameter, cortisol, epinephrine, IL-1, IL-2, all the metabolic, cortisol, everything, TNF-alpha, ACTH, everything that would normally go up during times of stress were blunted, attenuated, lowered by about 25%. So just having fish oils on board made the metabolic response to a stress lowered by 25%. And what does that mean? That means they burned less lean body tissue. When you burn less lean body tissue, you get out of the hospital faster. You get out of bed faster. You get off the ventilator faster. You recover better. You don't have to go to a rehab facility. You can go home because you lost lean body, didn't lose so much lean body tissue. So they said, everybody complained about that study. This is ridiculous. It's done in healthy college students. I don't think that happens in people in the ICU. Well, then we took people who were undergoing cardiac bypass, identical data. We could lower the response to cardiac bypass by 20%. Okay, and then they showed it in Whipple procedure. The biggest surgery I do as a general surgeon is a Whipple, pancreatic cancer. We take out the head of the pancreas, half the stomach, half the biliary tree, for proximal duodenum. 6 or 7 hour operation. We sew it all back together and pray it holds. Okay? That's a huge operation. Same thing. We lowered the metabolic response by loading those people with fish oils to lower the metabolic response. And there's lots of clinical studies. I won't bore you. This is a couple ones showing decreased infections, decreased hospital stay. Again, this is our best journal for surgery, decreased reported infections. On this one here from Emma Oslo in Australia, same thing. This is the biggest study from Japan, 75 studies, 7,000 patients. Now we actually show loading them with fish oils and arginine can lower mortality. This one published last week, Annals of Surgery, 1,300 people, only giving it pre-op. Just loading the patient pre-op showed decreased infection and linked hospital stay. So clearly, fish oils get your body ready for a metabolic stress. So if you load the patient and get their fish oils high, when they do get a stress, if they do get a stress, they handle it better. Okay? But it's not perfect. In acute lung injury and ARDS, lung fibrosis, we don't see consistency. In cardiac stabilization, it will prevent new arrhythmias, but does not prevent, if you already have AFib, you're not going to correct it. Prevention of fatty liver, consistent. Every paper is pretty much across the board. But really brain injuries where we've got some very solid data on the fish oil. But we've been lost again on trying to prevent it. Okay, so what do we see is, if we know what happens normally, we get inflammation, injury, blood, invading organisms, injury to your vessels, you can either resolve it back to normal, you can form an abscess, or you can get scarring or chronic inflammation. Obviously, we want to go back to normal, right? Okay, so if we look at that, this guy here in 2003 had a concept. He said, every biological system has an on switch and an off switch. So we've never talked about on switch, off switches for eicosanoids, pro-inflammatory fats. Well, I was talking about it always turns everything on, but doesn't turn anything off. So he said there must be an off switch. Long story about how he thought of that, but we'll talk about that if you have a question. So he discovered in 1984 lipoxins. And then finally in early 2000s, he discovered this new compounds that your body will make. You don't have to, in most cases, if you have them on board, your body will make them. Now you can take them and accentuate that, but But you can see what they do is they enhance that resolution, basically increase killing by the bacteria, of bacteria by your macrophages. They enhance, accelerate inflammatory debris removal, and so multiple things. And so these are a new class of compounds your body can make now. Again, you don't have to take these if you have fish oils on board. Your body will make them. And look, they work on all your cells, basically, to decrease the inflammatory response more rapidly. So if you have these so-called SPMs, specialized probiotic molecules, we get resolution and normal tissue healing as opposed to going to a chronic inflammatory state. Again, same thing, you can't, they're not much in the diet, but you can make them. Every tissue in your body can make them. Tissue you'd expect to have, like breast milk, for example, is full of SPMs because we don't want the baby's GI tract to be inflamed. Okay, so they're made everywhere in the body. But here's just a couple of the bigger studies showing we know we have better bacteria killing. We increase the ability to kill those bacteria and clear them in infection. We know they work for viruses too. SPMs were approved by the FDA for injection into the eye for viral infections. First thing they got approved. It was the most rapid non-orphan drug that got approved by the FDA for viral infections. You can see these in the animal. This is flu, this is the eye, this is the control group, and the treated group. Almost normal, because it decreased that inflammatory response. What about pain, post-op pain? Pain is inflammation, right? Started by inflammation. We lower the inflammatory response, we decrease post-operative pain. Okay? How about in sepsis? We know now that people that are septic, the ones who do better, have a higher SPM levels when we measure that. Now that's association, not cause and effect, but we've seen that association in sepsis now. What about cancer? You know, when I first started my training in nutrition and as a surgeon, we were told 30% of cancers are from dietary change, from eating the bad stuff, 30% are from environmental exposure, and 30% are from genetics. Guess what? Now it's 50% from what we're eating if we have the right genes. Okay, so now you have to have the genetic profile, and if you eat the bad diet with a certain genetic profile, you're a setup. So that's completely changed from in the past, okay? So we know that, inflammation and cancers are clearly associated. We know that cancer cells really can do everything a macrophage can do, an inflammatory cell, right? Basically, angiogenesis continues to grow vessels, unlimited replicability, evasion of apoptosis means, senescent death. So all the things we have, we can say, what cancers do we have? Papilloma, gastric cancer, liver cancer, cervical cancer, bladder cancer, colorectal cancer, scar carcinoma, asbestosis, mesothelioma are all chronic inflammatory conditions that only after years of chronic inflammation do we develop the cancer. Okay, so now, what can we show? We know that SPMs have a protective role. And again, they decrease inflammation, decrease angiogenesis, but really here's the proof in the pudding here. Just published last year in December of 2018, they showed in human studies when you radiate the tumor, we kill tumor, right? So inflammation is dead cells cause more inflammation. If SPMs are on board, we suppress the inflammatory response and clear that tissue debris faster. So we clear the dead tissue, which would propagate the inflammation. Very nice paper, enhancing endogenous clearance of tumor cell debris. Again, with SPMs. Same thing, what about obesity? We know obesity is an inflammatory state. We know that once your BMI gets about 35 to 40, we do not process SPMs well. We have to then take more SPMs and more fish oils. It's a dietary change. How about head injury? We know a lot of guys coming back from Iraq. I was in Iraq. I knew a lot of guys that got blast overpressure, near an explosion. What happens? They get injury in their head, DAI, the diffuse axonal injury. Okay? So what do we see? We know that over 200 oxidation products are noted in the brain within 24 hours of an injury. The first few hours, they're pro-inflammatory, and then the anti-inflammatory fats start to be developed. The SPMs start to be developed if we are loaded with fish oils, if we have fish oils on board. Okay? So we know that the damage, as I mentioned already, is surrounding that area of damage. So if we have these SPMs, we're going to do much better, increase cell survival with induction with multiple survival proteins. So I think we can say lots going on here. Virtually every tissue gets better, okay, if it's inflamed. I think I could talk about any one of these models, but this one's a very interesting model. This not only shows us the injury to the bone, this not only shows us that we can actually get less inflammation, we can get regeneration. So what they did here was they took the eye tooth out of a big pig, 75 kilogram a pig. They took that out. And they put a silk suture through there to give it chronic osteomyelitis of the bone. You know, as you know, when you go to the dentist, we got to clean dental periodontal work so you don't get bone infection, because bone infection erodes the bone. You've all seen older folks that lose their teeth and they lose their jaw. So what happened here? So what they did is they left that in there and it caused erosion of the bone. The bone literally dissolves away with chronic inflammatory phases. You can follow it by x-ray, very easy to follow. And then they take the suture out and they give control versus SPMs. They get regrowth of the bone. In the control group, no regrowth. It didn't get worse now because the suture's gone causing chronic inflammation, but didn't get better. In the SPM group, it grew back. The high fish oil group, it grew back. So regeneration is a whole new concept, which we're looking at. We know remyelinization after traumatic brain injury, diffuse axonal injury. What happens here is, you know, the gray matter in your brain is heavier than the white matter. So when you get an explosion or you hit the wall on a motorcycle or a car accident, your brain obviously goes too. Well, the gray matter moving heavier, right? Force equals mass times acceleration. So the gray matter moves faster. The white matter being lighter doesn't move as fast. And so you get stretches on those axons. So you get diffuse axonal injury. I see it every time I'm on trauma call. We get a young guy crashes his car, comes in, maybe had a few drinks, and he's not awake. He doesn't wake up. He's got a Glasgow coma, the way you follow out of 7 or 8. And what happens? Next morning, he starts to wake up, and usually they do better because it took a while to remyelinate those nerves. Those nerve fibers that got stretched and broke, and some of basically the insulation of the nerve got broken. It takes a while. With a blast injury, it takes a little longer. But you look at their CT scans, and it doesn't look like they're bad. Okay, the guy has DAI. We got to watch him close until they start to wake up. The worse the injury, it's worse. But we now know we can regenerate even liver. You know, when you take out half the liver, it'll grow back. We now know in experimental models, taking out half the liver, giving them SPMs, it grows back about twice as fast. So I think we know that SPMs work. So where can they work? Virtually everywhere in clinical medicine. Everywhere we see these chronic inflammatory states, we've got models almost to see them, almost every chronic disease. There's a lot more to be done, but I think knowledge translation takes a while. You know, I work obviously in a big teaching hospital. You know, I have 13 chief residents in general surgery. It's the biggest surgical program in the country, actually. Graduate 13 chiefs a year. They leave with an understanding of SPMs. They go out to their other hospitals, they call me and they say, Bob, we don't have any fish oils here for our patients. What are you talking about? Don't have any fish oils. This is now approved by the FDA. We've got this, we've got that. We can get IV fish oils. You know, what's going on? What do you mean? And so, but there's a knowledge translation takes a while. So it's up to us to go out and spread the word that we need to have understanding the science. So, you know, again, all these diseases, again, we know these are very tightly conserved through evolution. I have to be a little careful here in the South. You know, I used to live in Augusta when I was at Eisenhower. Couldn't talk about evolution in Georgia. I guess here in North Carolina, I better be careful. In Oregon, we can talk about it. It's okay. But basically, they're conserved, you know, right from these nematodes, these small worms we see microscopic out there, human. The last thing I'll talk about is for a minute is how our diet affects our microbiome, the bacteria living in our gut. We need to think of those bacteria as an organ. They should be thought of, and we should take care of them because they can destroy you. Okay? We got within 1 cell layer thick, right? There's enough endotoxin in every one of our colons right now to kill everybody in this room. We're not dying because that one cell layer is well protected. Our body does a good job of protecting us from the endotoxins that the bacteria in our colons produce. Okay? So they save us. They produce vitamins, minerals, amino acids, butyrate, anti-inflammatory compound. Lots of mechanisms that I won't bore you with. All of these models, chronic diarrhea, C. diff, ventilator-associated pneumonia, all of them are benefited by probiotics, the concept of giving back healthy bacteria to sick people. What about prebiotics, whole grains? Again, we've degerminated our grains. So what are we feeding them? Not whole grains. So feeding whole grains, we know, all cause mortality. In many huge, well-controlled studies now, showing that eating whole grains lowers cardiac disease, cardiac death, cancer death. Again, major journals, look, British Medical Journal, Circulation, Nutrition, Gastroenterology, all major journals now have proven to us with millions of patients and prospective studies that whole grains are the way to go. Prebiotics also help the bacteria. They're the substrate for the bacteria. To show you how important whole grains are, is breast milk. 15% of the sugars in breast milk are not absorbed by the baby. So that doesn't make sense. You think, why would Mother Nature allow us to have 15% of our sugars that are in the breast milk not for the baby? Because they're going to make the perfect bacterial profile in their colon. There's food for the bacteria. Remember, worldwide, the number one killer now for babies under 6 months old is diarrhea diseases. If you have the right sugars feeding the right bacteria, you're going to not get infectious diarrhea. You know, I do a lot of work overseas. It's a big issue still. But to show you, with exercise has to come function. We have to exercise. These are two studies, I think, that are really illustrative. I think it's the last two, actually. So this study here shows this. We took people in the ICU, and we gave them a good protein diet, okay, with fish oils, okay, and then we exercised half of them every day in the unit. Even on a ventilator, if they could walk, we walked them. It's very labor-intensive. Physical therapists, 2 nurses, we walk people on a ventilator, pushing the ventilator, letting them walk. You know, we have adult ECMO, another story, like being on bypass pump when your lungs are failing. Okay, adult ECMO, we walk them on adult ECMO. No longer laying in a bed sedated until they get off that stuff. Okay, so we walked half of them, and the other half got our standard of care. And what the outcome parameter was? The number who got to go home from the hospital. Not that had to go to a nursing home or a skilled nursing facility or a long-term acute care place. They went home. 72% went home from their hospital stay with aggressive therapy. 48% went to a subsequent acute care nursing care. That's the proof that we say aggressive nutrition and aggressive exercise and good nutrition. And that's in 14th study. Look at this one in 2018. Now they actually got approval to biopsy the people's muscles with the 2 protocols. This is what kind of exercise they did, passive exercise, active cycling. We have little bicycles we put in the bed. Okay, little push things that they get in the bed. If they don't want them to work, we turn it on and it makes them go after we strap them in, okay? So this is the control group. Look at the size of those muscle fibers on biopsy. Within 7 days in the ICU, we lose 14% of the cross-sectional area of our muscle. If we keep those muscles going, if we give them substrate, they do well and get out of the hospital sooner. Oh, let's go back to our patient. This is CT. That patient was me. December 1st. Okay, 2015, I had a major stroke. Fell down the stairs, hit my head. The neurologist told me it'd be a year before you're walking again. You know, hemiplegic, completely out. Okay, I was operating in 6 months. Now what happened? Well, I did everything doctors had to do, you know. But believe me, I called my friend John there and said, John, you know, I've read the data by Charlie Serhan. I need some SPMs. So the next day by FedEx, I get a box of SPMs. They weren't even out yet. And I started taking them. So N equals 1 now. That's N equals 1. But I think fish oils make a difference. So if I don't eat fish every day, we take fish oils every day. I got all my family and my kids now because I really believe this. I take all my patients. I have heart transplant patients that come to my nutrition clinic because they've got chronic inflammatory conditions. We switch their diet around, get them on an anti-inflammatory diet, which is high in fish oils. They cut their CRPs, come down. They start to get better. They start to become anabolic. So believe me, it makes a difference. Getting people on anti-inflammatory diets make a huge difference. Whole grains, fish oils, and a couple other things. Okay, thank you very much.